Welcome back to Now Media's TV show, Pain Diaries, broadcasting here in Houston, Texas. We are back to talk with Megan Hansel, talking about Abbott's DRG therapy. Thank you, Megan, for being on our show today.
Thank you for having me.
Absolutely. So we've been talking about DRG and its role for focal chronic pain. And you unfortunately suffered from a focal chronic pain in your pelvis. Can you tell us a little bit about that?
Yeah, it was debilitating. The pain started after my third kid, so about a year after she was born. So I had 3 young children, and the pain had gotten so debilitating that I was basically on bed rest for the better part of a year and a half. It was really intense.
Wow, a year and a half on bed rest with 3 small children.
Mm-hmm. It was a lot.
I can't even imagine. So that's a lot of strain on your family, your significant other, whoever else you had helping, if you even had to pay for help for that. I mean, that's a lot. And for your kids too.
It was, and especially because it started out as, 6 to 8 weeks of physical therapy turned into, I'm now a chronic patient, turned into I was having minor surgical procedures every 90 days, and
Wow.
They didn't offer me near the relief that I've gotten from the DRG, and it was taking so much time away. I feel like I missed a lot during that time.
So how did you find out about DRG?
Well, we moved. Our family relocated to Houston to find better health care, and I found Dr. Fisher, who's my pelvic specialist, and she referred me over to pain management with you guys. And so when she did that, I think when we talked, you and I, Dr. Manzi, at that point, I had been doing these surgeries every 90 days, and that was not helping. I was doing additional pudendal nerve blocks. That also was not helping. And if anything, I felt like it was causing more pain to have these done and more flares than keeping it stabilized. So by the time we started our conversation, I think we brought it up quite quickly, if I remember correctly.
Yeah, and what kind of symptoms were you experiencing with this pain initially, and what prompted you to seek care?
It started out as just low back pain. It quickly ramped up into feeling, the only way I could describe it, as feeling like my pelvis was being pried apart with crowbars or something. So when that happened, it just felt like my pelvis was fracturing all the time. When that happened, I definitely knew I had to get help. I couldn't walk. I mean, that's what led to the bed rest. There's a lot of days I could not stand, or even sitting was painful. I basically could only lay reclined at a certain angle.
And you were working full time too while this was happening? Or?
I was working 2 jobs.
Wow.
And it started during the pandemic. So yeah, I was working 2 jobs, and the little one was not quite a year. So it was no daycare and a really intense time. I think I put it off as long as I could before I finally just could not handle it anymore.
So what we discussed in your consultation, hey, Dr. Fisher referred you over for this new treatment. You've tried therapy and more therapy and injections and Kegel exercises and all of these things, and we decided, okay, well, let's do a trial of the DRG therapy for your chronic pelvic pain. So the trial was about a week long, right? And what did you learn from that trial? How did it improve your quality of life during that time?
The trial was really amazing, and I actually got a little bit lucky too, because I actually got a little bit of pain relief beyond that trial. It kind of reset the nerves a little bit.
Awesome.
So that was really nice, because by the time I came back to you for the surgery, that was when I was starting to experience the sensation again. But when I realized this definitely, it gave me a really good idea of how much pain relief I was getting from the trial. And then also getting the opportunity to test it out before permanently installing it made me feel better. It gave me peace of mind. Obviously, the device could be removed, but you don't want to go through that. So it was really good on that front. And once I realized, because I get about 80% of relief from my symptoms,
It's amazing.
And so when I found that through the trial, I was like, I have to do this.
So it improved your pain by about 80%. How about the quality of your life? What have you been able to do better?
It's so much better. Before, I felt like I wasn't really living. I was basically surviving day to day, and some days it felt like I was barely doing that. I definitely experienced depression and, just poor mental health because I wasn't able to get up and do much of anything. I felt like I was missing my kids' lives. So that was really hard. But then now I'm definitely way more active again. I don't know if you remember, but I'm a geoscientist, so I was leading field trips and, taking my students hiking, and a lot of my work was very active. So it went from, I may never be able to do what I've been doing again to I think I can actually do this again. And I've even taken an international trip, which is something I didn't think I would be able to do, definitely after the pain got so bad, because I couldn't even sit in the car for 2 hours, let alone on a flight for more than 8. So it's felt like I'm like actually living, experiencing. It's really awesome.
That's so amazing. I'm so glad it's able to impact those type of activities in your life. And then I would guess with your kids too, you're able to hang out with them, do things with them, go on their field trips, all that stuff as well.
I actually just went on a field trip with the 2 older ones. They had a shared field trip, and I was a chaperone for that trip. And it was an outdoor trip, lots of walking.
Yeah.
They're in Cub Scouts, so we go on hikes, we go camping. It's definitely allows me to be a part of their lives in a way that I wasn't able to during the worst of the pain.
So, and then also, with your significant other, intimacy-wise, obviously pelvic pain is a huge barrier to being intimate. And so has that improved as well?
Yes, that's definitely gotten better. It's still one of those things because I have a couple of comorbidities with my pelvic pain, but I'm still working with my pelvic floor therapist and still working on that. It's definitely way better. I go to her weekly, and even she is able to tell me how much better I'm progressing versus before. It felt like I was hitting a wall. I wasn't getting the pain relief. My muscles that were hypertonic weren't able to relax.
Right.
I'm actually able to work on building up the muscles that atrophied during that time of being on bed rest, whereas before any activation would just cause so much pain. But it's definitely way better with intimacy in general. It's definitely something I'm at least willing to try, as opposed to before I was, not even willing to participate. So yeah.
No, that's fantastic. And the DRG helps with the pain, and obviously the function comes. But again, when you suffer from something and you're set back so far, you're still having to do the therapies and do all these things to strengthen. It's not instantly going to strengthen everything back for you. But again, it's getting you the stepping stone so you can live again. And it's so amazing to hear your story that you've had such great success with this therapy.
Definitely. And honestly, I wish I had known about it sooner, because I think if I had gotten this sooner, I could have made even faster progress, because one, I don't think my pain would have escalated as severely as it did, and two, I think it would have made that initial, the therapies that I am doing and continuing to do more effective, like they are now, obviously, then, and it would have just progressed me. That would have been basically 2 extra years of therapy, so that was working better, and 2 extra years of pain relief. So
no, yeah. Absolutely. Would you recommend DRG to others living with chronic pelvic pain?
I do. I definitely, whenever someone talks to me, I seem to find a lot of people with chronic pain. And whenever someone starts talking about it, and I'm like, hey, you really should check this out. And I notice a lot of people are hesitant, which I get, but that's what makes the trial so great. And it's honestly, I've had quite a few surgical procedures, and it wasn't nearly as invasive as one might think. So I think that was also really beneficial.
No, for sure. And me as the physician, when I ask the patients, some of my other patients, like, what have you done? Have you done a therapy? You've done these injections, you've done countless things, drugs, doctors, acupuncture, chiropractor, you name it. They've tried it. And the cool thing is trying it on. Yes, I'm putting the wires over the nerves that are in your spine. Yes, people don't necessarily like that at first, but when you've tried everything and you don't want to live with this pain anymore, it's definitely at least worth a try.
Absolutely. I mean, yeah, because I tried every single thing you just mentioned, plus a few others, I think. So I had tried quite a lot. I was taking so much ibuprofen on the daily that I was just like, I can't keep doing this to myself. And it wasn't even, it was barely touching the pain. I'm one of those lucky individuals that I have a high tolerance to most pain medications, and I metabolize them very quickly. So that didn't seem like a good option because, one, that I feel like increases the chance of addiction, and two, I also have 3 young kids that I'm looking after. So I couldn't be taking anything that was going to slow down my cognition or my response time or anything like that. I need to be alert, awake, and able to respond at a moment's notice.
That's a great point. Again, this electrical stimulation is not drugging you up. Your dose is electricity, not opioids. And it's really fantastic that you can stimulate those nerves and get that relief.
Exactly. And honestly, that's the other nice thing, because I've obviously tried TENS and other electrical therapies before, but this, I can't feel it. I can feel if it gets turned off by accident or,
right.
I've had to turn it off sometimes for maybe an x-ray or something like that, but it's really easy to do that. And if it stays off and I forget to turn it back on, I notice, but it's not like I'm feeling a buzzing or any weird sensation. Oftentimes I'll kind of forget it's there.
Right.
Which is nice.
That's
because,
awesome.
Yeah.
It's just kind of part of you now, and it keeps you going, and that's all your kids and you and your family could ask for.
Yeah, exactly.
I'm so happy you're able to join us today, Megan. Thank you so much for this interview.
Thank you so much for having me.
Absolutely. I'm Dr. Manzi with Performance Pain and Sports Medicine in Houston, Texas. This is Pain Diaries. Take care of you so you can take care of business.